Yeah.
Okay, like with the family, having boundaries,
Family with boundaries with family.
boundaries, this is what I mean. You can say no to something. You're like, no, I'm not able to do this. I'm not able to do that. Boundaries are very important in all relationships. Like
Yeah.
for romantic relationships, it's not always easy sometimes to leave the romantic relationships. You see, like before one leaves a toxic relationship, you've tried 7 times. I think also having grace for people who are
It's
in
interesting you have a
that.
number off of your fingertips.
Yeah, yeah, it takes time.
So what gives you joy in the work that you do?
I think what brings me joy, the healing. People will come, they go, they are suicidal, they are stable. It's such a joy to see they have purpose. It's such a joy
Yeah.
to see the growth, the progress. It is something that I look forward to in the work, the little impact that I make in the mental health space.
Yeah.
Yeah.
Audio Jungle.
Are you ready for this one?
Yes, I am.
All right. Thank you very much for making the time for coming for this conversation. And also, dear viewer, thank you very much for coming back. This is our second conversation of the year. The first one was with the proprietor of his studios, that is Wenjiku. I hope you enjoyed that. Yeah, if you did, this is another conversation that you definitely need to be watching to its entirety. And as we always say, if you've already made a million, probably this is not a conversation for you. But if you are well on your way to make your million, this is a conversation that you should listen to. And mental health is something that is very important. There are even government policies around the same. But we, to some extent, we take it trivial. I don't know if we do, but I tend to think that people take mental health to be trivial. When you hear somebody say, oh, I am going through a challenge, and you're like, is that a challenge that you're supposed to be going through this day and age? So the guest we have today is going to help us debunk all of those myths and get us to clearly understand what is mental health, what can you do if you find yourself in such a situation, and how can you keep I use the word zen. I don't know if it's an ethical word to use in the field, but how can you keep a zen mind as an entrepreneur or as a person who is building out their dream? Because there are so many things that we encounter when we try to build out our dreams. When you get no's, what do you say? What do you do? When you make it, what do you do? And things become overwhelming. So that is what we're going to be talking about today. Without further ado, kindly introduce yourself.
Thank you for having me. My name is Emma Muchoki. I am a practicing psychologist. I have an office space in Upper Hill. I also see some clients in some space in Karen.
Yeah.
That's what I do. I listen to people for a living.
Oh, that's quite an interesting way to put it.
Yeah, I listen to people for a living. There's a lot of stories,
Yeah.
Yeah, and helping to get solutions, also diagnosing mental health conditions, referring to the psychiatrist in case there's need to have medication,
Yeah.
supporting families and equipping them with knowledge on how to support a loved one going through a mental health issue, also day-to-day stresses.
Yeah.
That is what I do for a living.
Interesting. You've said a mouthful, but let me start it from here. How do you find yourself listening to people as a business?
How do I find myself?
How did you find yourself there? Like you have to sit down and start listening to people.
I did my first degree in KU in psychology.
Yeah.
I was easy. I just wanted to be self-aware. And then after, that period when you're looking for work, trying different things, that period post school, I think those people actually need a lot of support, It's so unstructured, you don't know what to do. So I would volunteer here, there.
Yeah.
And there's a time I listened to this, there's a lady who came one day to make my sister's hair.
Yeah.
And they said their cousin was struggling. So I said, I have done a bachelor's in psychology, I can try listen. I listened, and after some time, I listened to her for like a few hours. And then after some time, they said, this person got helped. Can we give you another person who is going to pay? Because they felt like their cousin was written off.
Yeah.
And we were able to have a conversation, and they found like a way out of their issues. So now after I was like, okay, clearly I'm good with the work, and I did psychology. So after some times I enrolled for my master's in SIU. in clinical psychology,
Yeah.
which I have finished everything. I'm about to graduate this year.
Oh.
Yeah. So now I was like, let me follow their path. It works out for me well.
Yeah.
Yeah.
Interesting. From a child, did you like pigaing stories with people? Then when you grew up, you sort of realized yourself. How was sort of your childhood? Did you ever think that it would lead into what you're doing currently?
Not really. I never really thought about it like that. But I feel my childhood made me have empathy for people. I feel like there were difficulties here. There are some things that are outside my control.
Yeah.
And I feel like it makes me have empathy. I think if life was very all good, all rosy,
Yeah.
I'd be like, yo, why are you suffering? Why are you feeling like this?
Yeah.
So I think sometimes our experiences do shape us, how
Yeah.
we solve issues, how we how we are right now.
Yeah.
So it did make me have some empathy for people.
We hear big words like empathy. Could you sort of unpack the word itself?
Empathy is where you can put yourself in another person's shoe. Sometimes when one is not empathetic, we can be very invalidating.
Yeah.
Like you'll tell me I'm going through a hard time, I'm like, you Alan, just get over it, But having empathy, I don't know what Alan, I've never been through Alan's experiences,
Yeah.
but I hear you. I understand what you're going through and it's valid how you're feeling. I'm not like, you need to snap out of it, You hear somebody from their perspective, because as a human, you can only go through so much experience. It's very limited. My experiences, the experiences other people,
Yeah.
they are very limited. We'll never understand other people's experiences, Yeah, but putting yourself in the shoe, you're like, yes, this person is going through a rough time, and it's okay, they need to be heard, and how they are feeling is valid.
Yeah.
Yeah.
Would I be right if I liken the empathy to perspective taking?
What about that?
Perspective taking is sort of this I oftenly apply to arguments. Yeah, and when somebody argues something that I do not totally agree with, I will need to take their perspective and I get to understand it, and once I understand it, I can either go ahead and validate what they have said or say, okay, it's okay, that's your perspective, I understand it, but then I'm not going to accept it. Would that still qualify as empathy?
I think empathy should not be trying to figure out, am I going to agree or not agree? Because like if you said you are heartbroken,
Yeah.
I may argue so much, your values are not my values. It's not I'm correct and you're wrong. It is
Yeah.
okay. Alan has said this is what he's going through, and that is fine.
Yeah.
That is fine. I'm not trying to debate against why you're feeling the way you're feeling. Yeah, I'm just trying to take your word for what it is. Yeah, and your experiences for what they are.
You talked
Yeah.
about heartbreaks. There are so many on these streets, yeah?
Yeah.
Now to mental health itself, I hear there is a difference between mental health and mental illnesses. Could you tell us a little bit more about that?
A mental illness means you've met the criteria for a particular disorder. And there is a criteria you follow.
Yeah.
Like for depression, you need to meet 5 symptoms that are listed in the book that the psychologist used, which is called DSM. 5 symptoms: low mood, insomnia, or the opposite is sleeping too much.
Yeah.
Sleeping too much. Like 5 symptoms that are listed, and they need to be consistent for 14 days. So you can't be sad for 3 days and then you're like, I'm depressed. I'm depressed. That you don't meet the criteria for mental illness, But then if you've gone like 4 days, let's say you're heartbroken, you're not eating, you're not sleeping, and maybe the 5th day you're sleeping, then or back to normal, you're having like your mental health is struggling, but you don't meet the criteria for a mental illness. And even with the psychosocial issues like relational distress, they also need to be heard and presented to a mental health professional or having a supportive social support,
Yeah.
people who have good friends. If you tell them, by the way, this happened, they will hear you out, yeah. So that is the difference. And the day-to-day stressors also affect how we feel about, they also affect the mental health, but it doesn't necessarily mean you have a mental health condition, but it needs to be sorted out early to avoid getting to the
Now to the
place
illness
where
part.
of the illness. Yeah.
Interesting. Which are some of these illnesses that would be on that particular spectrum?
There are actually so many, so many. Just to mention the common ones, there's depression, low energy, low mood, all that, but you need to meet the criteria,
Criteria
right?
first, yeah.
There is also anxiety, where one worries about everything, and they can't control their worry. There's also social anxiety, where somebody has issues going out in public, talking, all that. There's that. And then there are things like neurodevelopmental disorders,
Yeah.
autism, ADHD, all that. And then there's also disorders like in the psychotic disorders.
Yeah.
Those ones are things like schizophrenia and the like. And with psychotic disorders is where you have hallucinations and delusions. Hallucinations is where you see things that are not real. You can see people running after you or talking to you, and other people cannot see it.
I always have people talk to me in my head.
You do. What do they say? What is the voice saying?
They tell me how I'm destined to be great.
How you're destined to be great.
Does that mean that I have an illness?
I think when you talk of of them, it's like where the hallucinations that people cannot see what you're seeing, but we have that voice in our head,
Yeah.
but not when it is way out of reality, like now if you sat and said, like, no, a delusion, you said Emma wants to kill me.
Yeah.
So it can be proven. I've not threatened you, like the reality versus that. If I have threatened you, I'm like, I'm looking for you to stab me, we can be like, that's true,
Yeah.
Yeah, that is true, right? So there are experiences that are out of reality. But yes, usually think as a human, we think to make decisions,
Yeah,
we
and
have
actually
a
that's where I was going to
voice.
get you at, yeah, because and given that this is also entrepreneur best, yeah, entrepreneurs thrive on the ability to sort of retreat within themselves, and then they try to find solutions for the problems that they are solving. Not necessarily problems, but for the things that they are doing. And most of the times you might have conversations with people and they do not totally understand what you're talking about, but you are seeing the sense. Yeah, so could you sort of find a balance between them having for them being what an entrepreneur is really, and also them not actually meeting the threshold of probably having a mental illness. And entrepreneurship is a day job, yeah. So it will pass the 14-day threshold that we spoke about earlier. Yeah.
Definitely, like people not seeing their perspective. We all think differently, and it's okay. That's why we'll go to your perspective when you talked about perspectives.
Yeah.
You may tell somebody your idea, they're like, I don't think it's going to work. That doesn't mean there's an issue, really. There are those differences in how we see things, what we think will work, what will not work,
Yeah.
and that is based on experiences, maybe coaching, whatever it is one has been following on the entrepreneurial journey. But when you talk of, and thinking is okay, like even right now you make your decisions to what do I eat for lunch, it doesn't mean there's any issue. When you
Yeah.
talk of behavior that is away from the normal, there are things, you're hearing things that are not there, or you're seeing things that are not there, that other people cannot see, or having voices that, or thoughts that are intrusive, that are not real, but then your idea, you can argue on it, it can be like this and this and that, it doesn't mean there's an issue.
Yeah.
Yeah.
Interesting.
Yeah.
Interesting.
And Also, the
Yeah.
other thing I also wanted to mention, also sometimes drugs can induce psychosis, hearing the voices, the hearing voices, and
People talking to you and all of
yeah,
that.
and thoughts that are not and believing things that are not true.
Yeah.
Yeah, so even that, especially weed and all that, yeah, they're quite something. They can mess up with your psyche.
Yeah.
Yeah, and finding better ways to cope instead of using substances could be something good.
So there is absolutely something wrong with those who are saying and pushing for it to be legalized.
Definitely there is their perspective, but
Yeah.
as a mental health professional, having observed, seen clients,
Yeah.
for some people you see their genetics, they have predisposition for mental illness, so you use it and then you hear voices and then you have to go to hospital to take medication, you
Yeah.
know. Yeah, it can have, okay, from my experience,
Yeah.
from my perspective, we'll
Yeah.
respect the other perspective and their school of thought. Also from the other perspective of a mental health professional,
Yeah.
recreational drugs can at times do you a number and mess up with your psyche. Yeah.
So, given that there's so many things that with how you're explaining it, it seems that our mental health is very delicate, but we never seem to take enough precaution in making sure that that we take proper care of it. I would not want us to go into taking care of our mental health right now, but which are some of the telltale signs that we can look out for when my sort of my mental health starts going off of the trajectory.
Okay, one, we can talk of like a very, very low mood and nothing is improving, or very shifty moods, from being very happy to being very sad, but it needs to meet a criteria of over some period of time, not 2 days, and then you're like, yes, there's a problem. There's that. And then there are things like not showering, self-care. You know, you feel you don't have energy to shower,
Yeah.
to cook for yourself. Clearly, there's a problem.
Why are you talking to me? Okay, I have not been doing. So, what if I tell myself that I'm doing these things out of choice?
Out of choice, like not showering and not
Okay,
doing,
not the shouting.
which one specifically?
I listen to people laughing in the background. Not the shouting part itself, yeah, but deliberately say no. Today I do not feel like eating dinner, or today I do not feel like cooking. Today, yeah.
By you taking the step to buy food out, like, you know, to maybe you're tired and it's allowed
Yeah.
to buy food out there, you know, but then if today you decide you
Even
don't,
the outside option is not there.
for how many days?
Not for long. Not for long. Like twice or thrice.
in a day, in a week or so?
This is only particular to dinner, because it's tedious to make dinner, but I would have had a meal during the day. Yeah, but for dinner, you're like, no, I'm not about kuingia kwa hizo sufuria. Yeah.
I think it's important even to like consult, like even with maybe like a nutritionist on the planning for your meals, because when you do not even eat like properly, when you
Yeah.
do not eat, when you're hungry, it affects your mood. You may be irritable because you've not eaten. So that's why it's the little things that
Yeah.
matter,
Yeah.
and not when it's done today, tomorrow, the other day, you know. And I think it's important like to seek the professional help from a nutritionist. They feel like, you know, my eating habits are okay, you know.
Yeah.
So that they're in line and your mental health is okay. And you know, sometimes one may lack you don't have the energy to do so, but
Yeah.
then if it's an everyday thing, there's a problem. But there's room for somebody being tired,
Yeah.
just don't feel like eating, but the whole week or something,
No,
then
I've not clocked out a week.
you've not clocked out a week,
Yeah.
and that's fine, but it's important to take care of those little things. Yeah. So yeah, so there's the self-care part, not doing that, the showering thing. And you're like, nah.
You've insisted on showering.
Yeah, showering,
Yeah.
brushing the teeth, making the bed. Sometimes when one is struggling, you're unable to do that, you know. Also withdrawing from friends, you don't want to hang out with friends, you just want to stay secluded. Those are signs one is struggling.
Yeah.
Also could be things like crying a lot, your emotions are just all over. it could be a sign there's something wrong. Also staring out in the there's something I've also ever experienced it. I was actually reading where you stare like and you can't tell hours their hours have lapsed. So there's a time I was just also going through an episode of struggling with my own mental health. I had my own issues. I would sit at a window and 8 hours pass. I'm like, oh, 8 hours are
What?
done. Yeah. 8 hours
Exactly what? Okay.
for a season.
What exactly are you staring at then?
I was just looking outside the window, then I'm like, oh, it's evening. I didn't expect it to be evening. Yeah, and then you see if that goes on and on,
Yeah.
there's a problem. But the good thing, one social support, my friends are very supportive, so they would reach out, you know, they're like, Emma, how are you doing? But those
Yeah.
are signs you're not doing very well.
Something you need to seek out for help.
Yeah, also another thing, if one has suicidal thoughts, you feel like life is not worth living, clearly there's also a problem. Also the need to cope with drugs. You're like, I just can't sit with myself, let me use a substance to numb how I am feeling. There's an issue. There are people who use the drugs, you begin like for weekends, for friends, as a regular use, and then it gets to a time like you can't stay without the substances,
Yeah.
you know, and they are coping. You have to use it to sleep, you know. Then there's an issue. Also, not sleeping, there's a problem as well. Yeah.
Interesting. From then an entrepreneur's point of view, long hours without sleep. When you definitely put in the hours, time flies. Then you forget. Wow, it's already the evening. I've not had a piece of. I've not had anything to eat. I am talking to myself. I want to sort of exclude myself from people to sort of plan for what I have to achieve. How then would you advise them, or what then would they need to be to do so that they remain sane even in the process of doing what they have to do?
I hear you. And running a business is definitely something. It's not easy. I think even entrepreneurs need a support group to talk about their issues.
Yeah,
I know it's
that's why they have dreams in motion. Yeah.
interesting. At least it helps like the experiences you
Yeah.
hear, and then you're like, oh, the other people going through the same things. It's not easy to run a business. It's not easy to create a business. Sometimes maybe things are not going as you want. You
Yeah.
want to break even, and it can be overwhelming. But it's important as an entrepreneur to create a work-life balance. Apart from being an entrepreneur,
Yeah, you have
apart
other-
from work,
Yeah.
you have other things you do. You have an exercise schedule. You have friends, time to meet with friends, because work should not just define you as a person. There are so many things as a person that define you. You have hobbies. So it's important to create a work-life balance, to have self-care routines, you know, to also remind yourself there are things outside your control. There are things, there's nothing much you can really do, you know.
Yeah.
And to also be flexible, because sometimes things do not go your way, and it's okay. And to also learn like you don't have to be perfect. Things do not have to be perfect. We'll make the mistakes. Even if a business doesn't work, you have experiences that other people do not have, who've never tried running a business.
Yeah.
So being kind and compassionate to oneself will help in the journey.
Yeah.
Yeah.
Something that you've said that I find very interesting is you have to snap out of it and understand that your life does not only revolve around your work. How then do you snap out of that? Because I've found so many people who are guilty. You are on holiday, you work. You go back home to your family, you're still working. Yeah, even when you go to any other, you have to receive a phone call that is related out of work. Is it that we are never aware when we are doing these particular things, and how can we come to this awareness and then also getting to strike this life work balance? Many experts have said, okay, this work life balance is a sham, does not work. But from your perspective, how can entrepreneurs or anybody else out there, even as a student, even as a parent, how can they be able to pull this off?
Yeah, I hear there's the guilt. Even a parent, if you tell them, you know, even if you have a small child, it's okay, you can take some time away to recharge, because
To take time away from your child?
for even like an hour or so. You know, when you're overwhelmed, you're irritable, maybe on the child. So like you just
Yeah,
you're,
you even making the
it's a
whole thing worse.
yeah, it's a
Yeah.
lose, you know. And then the things with the mental health, there's a lot of personal responsibility. You know, like when you go to hospital and then you're given a tablet, you're told the infection will be done in 3 days. Now with mental health, there's a lot of, I need to take responsibility, I need to create boundaries. I'm going to answer my calls at this time,
Yeah.
and this time is family time, and that is it, you know. So you need to consciously decide, I need to take charge. If it's the gym, you've decided you're going to be exercising to take care of yourself, you know, you have to plan and decide, I'm going to show up even when I don't feel like it,
Yeah.
because it's for my own well-being. Because if you crash, the business will also not work. If you're sick and you're out of it and you need to go to hospital for a period of time because of stress-related illnesses, you see, it still doesn't make sense. It's a lose-lose in
Yeah.
the end if you don't look out for yourself. Yeah.
What sets people apart? Sometimes I would say leaders, those in politics, sometimes they tend to look at themselves as better off people than others. Those people who have made a bit of money, they tend to look at other people as if they were better than them. What truly sets people apart from a psychological point of view?
What sets people apart? Let's see. It's a difficult one.
Yeah.
What sets them apart? I feel like sometimes we forget like where we are from, and we lack the empathy. And you need to learn human experiences. Like, as long as you're alive, you're a candidate to any experience. Those ones who have struggling businesses, you're a candidate. Those ones who have businesses that are doing
Thriving,
well,
yeah.
you're a candidate for that. So having that empathy and learning human experiences are universal.
Yeah.
Like, it doesn't have to, it's not that you know, you're lucky then, but another time you could be unlucky and the other people are lucky. So learning experiences are not very unique. They are universal. And learning, let me have empathy for other people who are trying things out, you know, because even me could also be struggling.
Yeah.
I don't know if that answers the question. I think that does.
And I ask this because sometimes you look around and you're like, if I've been able to come out of this, then why haven't other people been able to come out of it? And we were to some extent dealt with the same circumstances. And actually the question would be more as plain as possible: why are some people unsuccessful and others are successful? And most cases they were dealt the same the same opportunities. Case in point, wale vijana hutoka ushago, yeah, and they go wherever they go, they make something out of their life, but wakirudi ushago, wase waligoro na wao, they find them in the same in the same place. From a psychological point of view, does it mean that other people have inept, or they have inbuilt grit for some things and others do not have it? What really transpires from a psychological point of view?
Okay, there are very many factors that influence our traits. You know, there are people who are more resilient. Some people will be like, no, I'm not going to do this again. Some people will keep at it. You know, they are very resilient, and such traits, being successful, it's easier. And also our environment probably will also, maybe even your business you had, there's a perfect environment. If you got the opportunity, maybe things would thrive compared to a particular environment. And as you said, those people in Ushago, some have come to Nairobi, so you see the environment has changed. The people you meet, they influence how you think, how you run the biasharas. It's not the same as somebody who is in the rural areas again. It's just that the opportunities and also your inborn characteristics.
Staying on the Ushago part, because most of us, except those, I won't say most of us, except those when I want Ushago, but there is this connotation. I don't know if it's at year 8 or year 13 when a person's brain stops sort of growing. Is this a fact?
It's 25.
So once we hit 25, your brain is not going anywhere.
Yeah, no, you're
You're mature.
developed. Yeah, you're even like you find no one is more logical, not making decisions more on impulse. You're more logical. Yeah. It's 25.
More logical. Qualify more logical.
More logical.
Yeah.
If you use like an example, let's use like in the relational setup, you'll find like women, people who are dating like very young women, they are sometimes unstable in the decisions they make, but an older woman will find they are already stuck in their ways. They are not today, I mean tomorrow. I thought about otherwise,
Yeah.
there's more logic put into it. If you try like look at the relationships your friends, the people around you have, you can tell, they're more logical in the thinking.
Yeah.
It's not based on emotions mainly. Yeah, if you try check it out.
And then I might ask you to debunk a myth for us or bust a myth for us. There is this story, Sadio Mane. You know Sadio Mane?
No.
Okay, Sadio Mane is one of the most famous football players on the African continent, and I think it was yesterday. He is 35 years of age, and he married. They said his long-term girlfriend, and this long-term girlfriend is 18 years. Yeah, and best of what you've said. And bust of the myths that are within the dating sphere, where men would be told marry a woman who is younger because they for whatever reason, yeah, but from a psychological point of view. And you've said that at 25 at least they are already in their ways. They have already sort of identified, this is who I want to be and this is what I'm going to be all about. Then why would people still want, I'm not saying it's bad to have younger women or younger men, but then from a connotation that somebody has already, their brain has already developed, and you would want to be with somebody who has already sort of self-identified themselves. Why would anybody would want to go under the age of 25 going downwards?
Most likely there are 1,001 reasons. Maybe she's just a beautiful girl. And that's what he wanted.
Yeah.
And probably it can work. We are not going to say everything will not work. Maybe their goals are going to align and work.
Yeah.
It is very individual, person to person. Maybe for him it's like, yeah, this is what I want.
Yeah.
And people value different preferences, Maybe for one is stability in the person's thinking, for another one is a beautiful person, you
Yeah.
know. So there are 1,001 reasons that could explain why one would make the decision they
Yeah.
would make. But for the 18-year-old, probably when she's not 25, she'll be more, she'll have her own identity, and it may be different from what she
was
was
initially
when
when
she initially got into the relationship. Or it may merge and they have something beautiful and
Yeah.
have a beautiful family. So it's case by case. And depending on what a person wants.
Because I'm even here still debating in my head why our forefathers decided to go for younger women, and you would also find this to be true in is it not necessarily in Muslim families, but in our olden days you'd find old men getting married to younger women. So I thought there might be a sort of a psychological trait to that, but all right. Making decisions. What is the proper sequence of making decisions? Is there any proper way of making decisions?
It is very relative, but looking at the consequences of
Yeah.
the decision you make, it's important so that you own the responsibility of the decision. You're not like, no, I should not have done that, so and so said. Like, it's okay to ask yourself. Every decision has a consequence.
Yeah.
Probably like with the 18-year-old, she'll be very pretty, all that, put together. And then there's somebody, but there's the 50-50 of, will she still be the same person?
Yeah.
Will it still work? And then there's an older person generally, and there are also the consequences that come with it. And even with business, there are decisions and there are consequences. So asking yourself, am I okay with the consequences that come with this decision? If you are okay, you own it, so that you'll be like, yes, I made this decision. And taking personal responsibility is very important, because you'll not be blaming, not be like, it's Alan who said I do this. You'll be like, no, I decided and it has worked or it has not worked, and what is next? Yeah.
You've called me out there and you're like, it's Alan who told me to do this, and then you're supposed to say, no, it's me who asked myself or who prompted myself to do this particular thing. How then do we train people to own up? Because I've realized that is a challenge, where there is a comedian, I think it's Cat Williams, and he has been treating of late, and he was talking about I will use this example. It might go either direction. He was talking about women saying that men mess up their self-esteem, and Cat Williams was like, there is a reason why it's called self-esteem. Yeah, there is a self in there. Yeah, so how then do we teach people to be able, now this is general, male, female, young children and all of that, because it's very important. How do we teach people to own up to their shortcomings when we make decisions and they do not turn out as we want them to be? Is that something that we can train in for people to have, or we just let them and they realize it later in their lives?
I think even if one, like with the children, if you have a child and they make some decision, they don't do like, their assignments and get into trouble, you need to show them their consequences for that. You're not like, no, it's okay,
Yeah.
they hit somebody and then maybe they're hit back. You're like, yeah, there are consequences for the decisions
That you make.
So teaching them from that right age, like, why did you do so, like, why did you decide to do so that they own up. And even treating even children like people, like they have a mind of their own, so it's not like you make decisions on their for them. And even like in a situation of somebody who is working with people, it's good to give people autonomy to think on their own, because they have their ideas. It's good to give them that space instead of being like, do this, do that, being controlling. You give other people agency to be and to make the choices that they want. But having that in mind, like, there are consequences, or these are the objectives we need to meet at the end of the day, and this is what needs to be done. Not necessarily micromanaging, but giving them that space to decide what they want.
How do I go out of micromanaging? And also, given that as a team lead, I might be guilty of micromanaging. How is it me? Is it supposed to be me who is supposed to let people do what they are able to do, or is it the other person to show that I am in the position to do what I have to do?
I think when you hire people, you need to believe in their capabilities. You've interviewed them and you're like, I know you're good.
Wow.
I know you're good in this,
Yeah.
Like, I know you're good in this. So when you hire the people and you've decided these are the traits of the people I want, and you've identified, you give them the space to decide. Any human, like when you're controlling, like, when somebody's like, do this, do that, wash the dishes, do this, do that, like they have to tell you, like, these are the sequence, and you have your autonomy, you think as a person. It can get overbearing over time, but when there is space, like, okay, these are the goals we have, for these are the deadlines, this is what is needed to be done, and now as the leader you take responsibility for the people you bring to your team. But now if you bring to them and then you're like, no, I feel like they don't think, I don't like how they're thinking, let me, you're not taking responsibility.
So it's a me pro.
You need to take responsibility in the hiring, to look for people who you feel are fit to your team and who you believe in their capabilities to contribute to your team.
Given that we're talking about hiring and teams, are you able to discern people who are going to be troublesome on your team in the interviewing process, and which are some of the things that you should look out for?
Okay, that is difficult because people bring out the best in themselves.
Yeah, absolutely.
Yeah, because humans.
But you cannot entirely throw out your dirty linen all at once. You can be, either it can be in the questioning, or it can be in how the person conducts themselves. Yeah.
I think also, yeah, because now in the interview people will bring out the best in themselves. But I think when you give somebody like a 3 months probation, you'll be able to tell, do they do what we say they are going to do? Are they meeting the deadlines? Are
Yeah.
they a fit to the team? Because an interview, I feel like you bring out the best in you. Maybe you can look for a coach and like, yeah, you say this, you say that, you say that, because you have the work
Yeah.
and you're in.
Once you're in there, you become a menace.
Yeah. And I also think it's important also for somebody looking for work to look for work that they enjoy, work that aligns with their values, or a company that aligns with their own value system.
Yeah.
Because now if like your work is and your values are not aligning, you'll be struggling, and it's that now that when they make that decision to work there, at least they're giving like their all. It fits with what they wanted. Like the one would do a course, let's say like any course, like let's say maybe one was told by the parents be a teacher and they just don't like it,
Yeah.
compared maybe to somebody who liked whatever they wanted and wanted the teaching. You see, they'll do the work differently, and I think now the one who doesn't like needs to figure out what will work for me and what do I want,
Yeah.
so that they can be okay and comfortable with their work, because you spend a lot of time in a working environment. 8 hours is such a long time in
True.
a day, like
True.
it's a substantial amount of the 24 hours we have.
Interesting. Interesting. Then, as a leader, how do I get to communicate to my team that, yes, I have taken responsibility, but the work still has to be done? How can I be able to communicate with empathy? Because one, I do not want to lose them as an employee, and also I do not want to demoralize them as an employee. How then do I communicate to them that, hey, there is a challenge here, but then this is the solutions, or these are some of the things that we can do to move forward?
I think you need to learn to listen, and to listen to them and be like, okay, when you listen to the team, you'll be able to figure out what issues are they having, and put yourself in their shoes. You're like, okay, if I was in their shoes, would I do anything differently, instead of just looking at things from your perspective? Because maybe you have set deadlines, but if you try put yourself in their shoes, you'll be like, I see where you're coming from, I see why you're struggling, and having the open communication and all that, and trying to put yourself basically in their shoes.
Wow. You decided to practice yourself. You did not look for employment. Why?
I had a first job after I finished my undergraduate.
Yeah.
I had a first job. I worked for 10 months. It was a customer care role.
Yeah.
And I really appreciated at least I got an opportunity to work. But I felt like I just didn't like the work. I felt like I could do more. The work wasn't mentally challenging.
Yeah.
I felt
Wow.
like I wanted work that is mentally challenging. So I was like, this is not working for me. And with psychology, being a psychologist, I feel like the work is mentally challenging. You know? And the dynamics of the work is everything is new. Every person is different. Whatever they bring is new. But their work was so routine. My customer care work, we do this, we do that tomorrow.
There is a book that you're supposed to follow.
Yeah, and then call people. You have to follow a particular
system. You're supposed to say some particular words.
Yeah, I felt like it wasn't mentally challenging, and I wanted work that was mentally challenging.
Yeah.
That's why I made the decision to practice. Yeah.
Take us through that journey. And I ask you this question because of self-realization. Many people struggle with self-realization. You are in a job, but you do not know how to go out of it. You want to start a business, but you do not know where to start. How was your self-realization journey?
For the 10 months, I just felt I wasn't happy today, tomorrow, the next day. I'm like, no, this is not working for me. So I decided to enroll in graduate school for the master's and work on building a practice. That was the decision I made then. I just felt it wasn't working for me. And also as an individual, I'm not in places where I feel like things are not working.
Yeah.
I prefer finding a solution so that I am okay with the space I am in.
Yeah.
I'm not complaining every day. I would complain about the work. I'm like, will I be complaining every day about the same thing over and over again? So I made the decision to transition to something else.
Interesting. Will we ever go? Will we ever get to the point where we totally respect and understand that mental health is a serious issue out here that we really need to be akin to and solve and do what needs to be done to alleviate the effects that it would have on our brains, our performance, and our livelihoods in entirety?
I believe it is a step at a time, like even with the show, the people who are going to listen, it is a step at a time, and also destigmatizing mental health, also even avoiding using the mental health terms in a layman. You're like, this is delulu. Now when one maybe has a diagnosis and you told you're delusional, and people in the street say delulu is a solution,
Delulu is the solulu.
yeah, it's a solulu.
Yeah.
Those small things huyu amechizi, very small statements that would make, if you're told you're not stable or you need help, you'll be very defensive because of the way the words are used in the streets. Also, like, maybe somebody who has a mood issue, like, we are called bipolar, and it's not a diagnosis. Maybe they're having a bad day. How about if somebody else is told, they have bipolar, and the way they've had it being used, it's not in the right way. I think as a society, avoiding the stigma associated with the mental illness, avoiding using those words loosely to describe the day-to-day of the people we live around, and supporting people who are struggling with mental illness, taking them for clinics. And mental illness is just like any other illness. The way you'd have a stomachache, just the same way you'd have a stomachache, the same way your neurotransmitters are not working the way they should, and if they're not working how it should, you find it is affecting different things. Like, let's say serotonin controls our mood, so if it's low, you find your mood is very low, very very low. So just the same way now, like, compare the serotonin to like having like maybe something in your stomach, the acid, there's an issue. It's just the same way with mental health, just the same way another part of your body would be sick. It's just the same way when somebody is struggling with their mental health or has a mental health condition. So I think the stigma, slowly, like us accepting, like, we need to support people, we need to stop using the words loosely as a society. And also even as an entrepreneur, if your teammates are also struggling, like getting the help for them, because if somebody is not operating at the optimum, they're struggling. If somebody, let's say, is struggling to even make their bed, to cook a meal in an office, will they be productive? Absolutely not. So seeking help, and even encouraging them, please, if you're not doing well, it's okay, you can seek the help. Just the same you would have somebody having their pressure, diabetes, they go to the clinic and come back, and they're able to function with the symptoms getting managed.
Affordability. There's people will tell you, mimi niende nione psychologist ndiye niitishe 10,000 a session. No. How can we make this affordable, so that people can be able to access this expert advice? But also, one, there is that, but also there is the circles that you talked about. So first, let's talk about affordability, and then after that, you could talk about amongst our friends, how can we actively reach out to each other and just check on each other's mental health, because it's important.
Okay, with the friends, let me begin with there. Like, if you see your friend is struggling, it's important to be making a call. You're like, hi Alan, how are you doing? I've not seen you in our social circles, are you okay? If somebody is secluded, you can show up at their door, depending with the relationship you have with them. Also,
but don't show up with flowers.
Just a normal show up, at the door. Also, sometimes you'll find, like, you can also be supportive by taking people to the hospital. Like, sometimes, just like an instance, I have a friend of mine who has struggled sometimes friends with the mental illness, several friends, not one, my personal friends. And the days I'm like, okay, let me just take you, we go queue and wait to see the doctor. And later you're like, oh, they felt like you really went out of your way to show up for them, you know, instead of being like, I found you sleeping in bed and I'll leave you there. I'm like, no, let's go see the psychiatrist, you see what he's going to say regarding your situation. So that can also be some way to help people. Also, not invalidating the experiences. When you find somebody saying they're sad, you're like, even us, we have problems, you know.
That's a classical answer, you know.
Yeah, you might be the next one who can make your bed. You can't do anything. As you said, like, human experiences are very universal. You may be the one struggling next time, so offering the support is needed. Also, the other thing, on the affordability, I hear you, like, mental health services can be expensive, like, especially if you're like paying out of cash. You know, but it's not, is it 10,000? But maybe it is the one you consulted. Yeah, but you find like mental health services are quite, they can be expensive. Paying out of pocket. So that's why it's important to like pay for your insurances. You know, when you pay for insurance, the whole concept is having a pool of money, and maybe you've used a little bit of money. Let's assume you paid like 40,000, just an assumption, and maybe instead of paying 5,000 for a session, and you go for like maybe like 10 sessions, you see it makes more financial sense. So looking for insurances to cover for the expenses for your health, looking for one that is inclusive of the mental health, that can help instead of paying out of pocket. The other thing, even things like NHIF, they help with admission, like at the referral hospital on Thika Road, you know, NHIF, so one doesn't have to be home and they're struggling and need an admission. And you know, I don't think it's too much money compared to paying out of pocket.
Out of pocket all the time.
Also referral, level 5 hospitals must have psychologists. The level 5 hospitals, they do, like, we do have like Makueni, I'm sure like every hospital has a psychologist, and you'll hear them, the people who have serious cases are referred to the psychiatrist, and it's little money. Like the last time I checked, it was like 500, you know, but then maybe if you want like now private, you know, maybe we give it a cup of tea for more money, but there's help out there. The referral hospital here in Nairobi, the Mathare teaching and referral, you know, you get the psychiatrist, you also get the psychologist, admissions, and then there are also several private hospitals in the country, and that's there are options.
There's a lot. There is a barrage of options one can pick from.
Yes, because the other illnesses, why don't you hear people saying it's expensive, and it's always expensive? Actually, like the other things.
No, but malaria, just going for those.
It's not that much.
I don't know when I last went for malaria check, but it wouldn't be that much.
It's not that much.
Yeah.
But going to the hospital generally, especially if you pay out of pocket, it's quite a lot of
it's always
money.
serious.
Like the last time I checked in December 2023 in a hospital, it's like 3,500. It's quite a lot of money, and that's why I think it's important for people to look out for insurances to take care of their health, inclusive of mental health, physical illnesses, everything that can affect you as a person.
Interesting. As we're coming to a close of this conversation, then which are some of the actively, I know we've haphazardly touched on them, but now more actively and more robustly, which are some of the things that we can do to make sure that our mental health is in check? We're going to break it in a number of ways. I know we all go through these processes. Probably most all the same. It's only the intensity that differs. But let's start with entrepreneurs. What are some of the key things that you would tell an entrepreneur to look out for to be able to keep their mind, their health, their mental health in sound or in check?
One of the things that can be done is having having social support
Yeah.
from people who understand what you're going through. You can look for other entrepreneurs, maybe like you need seed funding, like an example,
Yeah.
and you'll find somebody has a person who they know, a person in the circles, you know.
Yeah.
So having people who you run the same businesses, or the same, who are in the same line of business, like talking about the challenges you're experiencing, you'll figure out their solutions, or sometimes you feel validated. You're like, oh, you're also going through this, and
Yeah.
it's very validating. You're like, I'm not alone. Running a business is not easy. So seeking for social support from other entrepreneurs. The other thing is eating right, as we said, like trying to keep your meals proper.
Yeah.
Sleeping enough hours, 8 hours. We said
No, there are people who offer advice to entrepreneurs, and they tell them, "Why are you sleeping 8 hours a day? That's a lot of time." Yeah.
but we said we don't want to be in a space where we'll get to being mentally not in a very stable place. You have admissions and then you miss work for a whole month. It wasn't worth it. And then, you know, when you sleep enough and being mindful, like you're like, okay, this hours I'm sleeping,
Yeah.
okay, this is sleeping time, this hours I'm working, being present, like avoiding your mind being scattered on everything, you know.
Yeah.
Being present, you're like, okay, this time Alan is sleeping, this time is family time, this time is time for my business, you know. Being present in whatever you're doing, at least it helps one to be more productive than being scattered. You're at night, and so that you even have good social support, because if you have like some family time, when you talk of also the work-life balance, you know, like your relationships are not strained, but no business is not working, the relationships people barely see, or you barely hang out or check up on them. You see, everything is clearly will be struggling. So being very taking responsibility for creating the work-life balance, so that you can maintain a sane mind and you're able to be more productive, and taking time for self-care, taking time for holidays. I know running a business, you know, it's not like you have holidays this time or leave this time. It's okay to schedule time a week to go away from the work and go take care of yourself and do the things you enjoy. Also, connecting with friends, it helps, like your social circles, whatever you do with them, that is also very helpful for an entrepreneur. Yeah.
Interesting. And then there are these people who are in toxic relationships and they never want to leave. What would you what would you advise them?
Romantic relationships.
Yes, that's I don't know if they remember, but sometime last year, I was told that it's not only toxic when it's romantic. You can even have family members who are toxic. Yeah. So how do you these are people that, for instance, family, these are people that you cannot entirely give away. Yeah. It's still going to remain family, but then if it's romantic, this is somebody that you met and you agree, you moved this journey together, and you grew fond of each other. How then, if they become if you then realize that probably they're not for me, how do you talk yourself out of that, and put your mental health first? Yeah.
Okay, like with the family, having boundaries, you know.
Family with boundaries with family.
Boundaries, this is what I mean. You can say no to something. You're like, no, I'm not able to do this, I'm not able to do that. Boundaries are very important in all relationships, like
Yeah.
all. If you are like the toxic family members, like what are some of the things you feel maybe one would be losing the boundaries on? Let's see.
Tuseme madha ameniambia nioshe vyombo na sitaki kuosha vyombo.
Okay, but you see also that one, if you're living with her, you need to take responsibility. Inafanya mtu ahame. That day-to-day issues, right?
Yeah.
The day-to-day issues.
Like expectations, wazazi wamekusomesha, they expect you to send them money.
Yes, that one is not a real issue. Yeah, and you can decide. Maybe you can decide I am comfortable sharing 5,000, not the 10 you're asking for. You know, not going to way out of your way
Yeah.
such that you're struggling. We're not saying no, don't help, but asking how much can I afford to
Yeah.
give? Because if you have to go borrow money to give, then there's a problem. But if you're like, okay, Alan can afford 10,000 to give to my mother, you tell her this is how much
I am
I'm
able to give
comfortable,
you.
I'm able
Yeah.
to give you. Yes, this is how much I'm able to give you, so that you're not on the end struggling to pay debts in a cycle
Yeah.
and trying to live a life that you can't sustain, and being very real with yourself, you
Yeah.
know. Yeah, so such boundaries, being like, this is how much I can give you, you know.
Yeah.
Yeah.
Romantic relationships.
For romantic relationships, it's not always easy sometimes to leave the romantic relationships. You see, like before one leaves a toxic relationship, you've tried 7 times. I think also having grace for people who are
It's
in
interesting
that.
you have a number off of your fingertips.
Yeah, yeah, it takes time. You know,
Yeah.
you've left, you've come back, you've left again, you've come back. It takes time. And having grace even for your friends who are going through
Yeah.
all that, you know, like romantic relationships, when you're getting away from somebody, it's like getting away from a cocaine addiction, the withdrawal. And then, you know, when you're getting from any drug, the withdrawal wants you to continue getting to the
Yeah.
drugs that you don't feel how you're feeling. So it's not easy even for people who are trying to leave the toxic relationships.
Yeah.
But I think also somebody having some level of self-respect, you know, like this is the bare minimum. I'm able to I'm willing to put up with. Like, if this is not there, this will not work. Having the little things that you said, you're like, this cannot work for me, or this will work for me, is also important. Also, seeking support from friends, a professional, because you see, with a relationship ending, it's a loss. It's a whole grief. You are so used to the person. You are used to having calls at this time. It's
Yeah.
not anything you're going to snap out of. So seeking support to go in a safe environment where you can talk about your feelings, how you're feeling, that would really help in the healing journey. And being patient with yourself, being patient with yourself,
Yeah.
taking it a day at a time. Yeah.
Interesting. Anything that you feel I have not touched person that you would like to put out there?
I would just wish to mention, like, when people are not feeling okay, their friends are struggling, it's okay for them to seek help. Even for men, it's okay for them to have feelings and to seek the help that they need when they feel things are getting out of hand. It is okay, and there's nothing wrong, or there's no shame in somebody struggling. It's okay to seek for the help one needs, and it is also a form of self-love, because the amount of time you'll use to go maybe for a few sessions and the amount of time you'll spend being fixed in the situation, clearly seeking the help will make the situation, coping with the situation, easier. The other thing I'd also insist, it's okay for people, it's good for people to find positive coping mechanisms, instead of looking for things that are destructive, like gambling, using substances to cope. You know, it's good for people to use positive coping mechanisms. Also, the last thing, it's okay for people to have bad days, to have difficult emotions. It just doesn't mean there's an issue. It's okay to hold space for how you're feeling, whether you're feeling not so good or even the positive emotions. Just the same way you give positive emotions space, it's okay for you to give negative emotions the same space. And sit in with them even when it's not that easy, instead of trying to be like, I don't want to think, I don't want to be
Yeah.
here. Being real with our emotions, with ourselves and our circumstances as much as we can be. Yeah.
You say it's something very profound there. Being able to give space to the positive thoughts, you also must be able to give space the negative thoughts, and just allow yourself to go through them. Interesting. We have a norm that we copied from a podcast that I listened to. It's called Diary of a CEO, and they have where the previous guest leaves a question for a current guest. I don't know if my producer can be able to read the question out for us. I had crammed it, but because of a nice conversation, I've forgotten it. So the question is, what brings you joy in the work that you do?
Okay, so my question will be on what self-care routines are you going to use to ensure your mental health is at its best? Is at its best.
Okay, so that we're going to keep it as a question, but then you also have to give us an answer for the question, the question that the previous guest left. So what gives you joy in the work that you do?
I think what brings me joy, the healing. People will come, they go, they are suicidal, they are stable. It's such a joy to see they have purpose. It's such a joy
Yeah.
to see the growth, the progress. It is something that I look forward to in the work, the little impact that I make in the mental health space.
Yeah.
Yeah.
Interesting. I'm going to be how do they call it? I'm going to be corrupt, yeah, and task you to answer the question that you have asked, because I realize I forgot to talk about that. Some of the key things that people should look out for. We've talked about actively seeking out social networks and all of that, but which are some of the other emerging things that people can do to be able to keep pretty good mental health. Yeah.
Seeking support, seeking support, as you say, the social support.
Yeah.
Also seeking professional help when there's need to.
Yeah.
Engaging in their hobbies, going out, like whatever they enjoy, like the kind of things they enjoy doing.
Yeah.
The hobbies are so different for the different people. Being in touch with their emotions and their experiences. Avoiding negative coping mechanisms such as drugs and the like.
Yeah.
Yeah.
Probably the last one is, why do people never meet their New Year resolutions? Is it a psychological issue?
Why don't people meet it? Maybe they're just excited about the year is coming and they feel like
I need something new to
I
look
need
at.
something new, but it's good to set like realistic goals, to also set timelines. You're like, okay, to break them down, because if you're like, I want to buy a car worth maybe 2 million, you need to break it down. How much do I need to
Save
up? By week 1, week 2, what do I need to do? To set very realistic little goals. And also the goals are good even when people set their resolutions, because they make them look forward. You're like, I'm looking forward to this.
Yeah.
But when you break it, you're like, oh, this week I met the goal, I did this, I did that, because it's the small things that add up to the end of the year. And it's okay even when they miss the goals. It's okay, the next year they can see what they could do differently and break them into small chunks and then see how to achieve them. Yeah.
Emma, what's your closing remark?
My closing remark: we take care of our mental health and we seek support when there is need to, the professional support, and we support other people going through mental health challenges without invalidating their experiences.
All right. Thank you for making time for coming.
Thank you too for having me. I appreciate the conversation we've had.